You're welcome back again. This is your nurse, Felicia. Can a woman with obesity get pregnant? Obesity is a condition where body mass index, BMI, is greater than 30. Excessive fat accumulates in the body. Poor dietary choices and sedentary lifestyle or genes are the main contributors to obesity. However, genetic makeup also plays a role. Socio-economic factors such as limited access to healthy food options can lead to obesity. Certain medication and medical conditions can also cause obesity. So in this video, we will discuss the link between pregnancy and obesity. Can obese women get pregnant? That's the question. Infertility refers to the failure to conceive even after trying consistently for 12 months or more. The risk of infertility is 3 times higher in women with obesity than others. Obesity can cause irregularity in the menstrual cycle and the absence of ovulation in some women. In obese women, there may be an increased level of secretion of male hormones. These hormones, what do? Prevent the proper development of follicles in the ovary. Moreover, studies has also shows that obese women take longer to get pregnant. The damaging effect of obesity on the egg, the uterus lining, and the embryonic development causes the delay. Obesity reduces the conception rate in women. In obese women, there is something we call adipose tissue, excessive fat. The greater the fat tissue, it releases more harmful chemicals. We call them adipokines than beneficial ones. As a result, PCOS, polycystic ovarian syndrome, worsens in obese women. PCOS increases the challenges of infertility, enhances the level of male hormones, the chances of a lack of ovulation. In addition to polycystic ovarian syndrome, hypothyroidism is also common in overweight women. The imbalance of the thyroid hormone in women is a likely cause of miscarriage. Then pregnancy and obesity are related to illnesses of the female reproductive system. And when we're talking about this, studies also report that obese women are vitamin D deficient most of the time. The higher the BMI, the greater the vitamin D deficiency. Moreover, obese mothers give birth to children with lower vitamin D levels. Vitamin D deficiencies causes many pregnancy complications and abnormalities in the baby. Furthermore, obesity and overweight can cause infertility in men as well. Obese men have a higher likelihood of developing erectile dysfunction. Do you understand? Erectile dysfunction, since the chances of conception are low in obese women, they may take fertility treatment, but even that does not completely solve the problem most of the time. And obese women have poor result after in vitro fertilization procedures most of the times when they do it. Okay, let's do it this way. Research does not state that obese women cannot conceive at all. No, that's not it. But it states that there are low chances of conception in obese women. The obesity causes complications during pregnancy. That's the big question. Obese pregnant women are at risk of developing various complications. And one of the major complications is gestational diabetes in pregnancy. The womb secrete different hormones, such as growth hormone, which block the production of insulin. High blood sugar levels due to gestational diabetes may result in various problems, which may include premature birth, premature delivery. Then the chances of type 2 diabetes in pregnant women also increases if they have gestational diabetes. Gestational diabetes may also harm the baby, as they may develop hypoglycemia and problems with their heart function. There may even be a risk of miscarriage because of what we're talking about. So obese women can develop pregnancy-induced hypertension, PIH. That's what we call preeclampsia. A waist circumference greater than 80 cm before pregnancy is a risk factor for preeclampsia. Obese women have a 50% higher chance of developing hypertension than women with a normal BMI. Hypertension can cause premature birth, and premature baby may have difficulty in breathing and developmental problems, right? Which can include their brain, improper development of brain or a lung. Obese women also have a chance of developing obstructive sleep and apnea. In this condition, breathing stops for a while during sleep, like when they are snoring. It can cause tiredness, heart and lung problems, of course, during pregnancy. And I also want you to know, additionally, that obesity during pregnancy can cause structural and functional irregularities in the baby. The baby may be born with a heart defect, a nervous system defect. The child is also prone to developing metabolic syndrome and obesity. Study also shows that obese women are at greater risk of miscarriage and stillbirth than normal weight women. You understand? So remember that pregnancy and obesity together can make the fetus larger than normal. That we call it a macrosomia or something. In this condition, there are risks of injury to the baby during delivery. It also increases the chance of having a cesarean operation or a cesarean delivery. You understand? Because the baby is bigger than the normal because of the condition of the mother. So take care of your health. Health is wealth, and see you in the next video.